If you've ever been freaked out about trying hyaluronic acid or HA filler because it seems like there's so much bad filler out there, we see it with our friends, our communities, online for sure. But here's the thing. Hyaluronic acid filler can be done really well. And the secret to doing it well is so that no one notices. So if it feels like there's so much bad filler out there, it's really because you are not seeing or noticing when it's done well. I'm Dr. Mina. Welcome to my channel, The Skin Real, where I give real people real skin information and education so that they can make informed decisions about their skin health. Sound good? Let's get into it. This is my weekly recap episode where I break down my key takeaways from my most recent interview this week with Dr. Rachel Westbay. She is a dermatologist in New York City, and we are talking all about specifically hyaluronic or HA fillers. If you want to hear the full episode, be sure to stick around to the end of this short video where I will link it. So let's talk fillers. Now, when we talk about fillers, we are talking about a substance that's injected into the skin that will either restore volume loss or help with facial balancing. Typically, when I say fillers, I am talking about hyaluronic acid fillers or HA fillers. These are going to be things like your Restylane, Juvederm, and RHA fillers. Those are kind of the big ones. And then within those categories, you've got lots of different names. I'm not specifically talking about this week with Dr. Westbay, things like Sculptra and Radiesse, which are more biostimulatory fillers that boost your own collagen. Now, why has filler gotten such a bad reputation? Well, there are a couple reasons. First of all, people are getting overfilled. And when they get overfilled, it is super noticeable because it doesn't look natural. When filler is done well, it's undetectable. People just look good. They don't look done. That's the trick. When they look overfilled and overdone, they start to look bizarre and weird and not normal. Their face doesn't animate like it should, and it just looks strange. Another reason could be an inexperienced injector. With the rise of fillers and the popularity of fillers, also med spas, it seems like anyone and everyone can get a weekend course or an online training to inject fillers, and they are. People who have zero medical knowledge or training are injecting these things, and it's a little bit scary, and so the results are not the best. They're not supernatural looking. And I also feel like some injectors just don't say no to their patients or clients, and they continue to fill and fill and fill, and it looks very unnatural and bizarre. And then lastly, there's been a lot of viral misinformation about fillers that has scared a lot of people off. These reports that it migrates across the face, that it lasts forever, almost as if it's concrete in the skin. Now, they may last a little bit longer. There may be some particles of filler that linger, and there could be some migration, especially around the eye area because of the lymphatic drainage or the mouth. But again, if you are using small volumes placed correctly, this really shouldn't be such an issue. So does filler last a lifetime? Is it going to be stuck in your skin forever? No. Parts of it may linger a little bit longer, but most people find that after about a year and a half, they either need to add a little bit more to maintain the look that they wanted. And again, it's all about small volumes correctly placed for the best, most natural results. So what are some of the best areas for HA filler? I think of HA filler when there is a focal area or a discrete area on the face that needs filling or balancing. I love HA fillers for the lips. I love them for the temples. You can put them in the chin to add some facial balancing, not because people necessarily want a bigger chin, but perhaps they have a recessed jaw. Maybe their nose is a little bit larger, and this just creates facial harmony. So people don't always think about filler as creating facial harmony, but sometimes just adding that symmetry and that facial balancing makes all the difference in the world. I also love filler for right along the cheekbones to help give a stronger cheekbone for people. I think looks really, really nice and lovely. You do have to be careful in areas like the tear troughs. That's going to be right under the eyes. You really need to be careful getting that placed because this area is prone to swelling. There can be some migration of the filler. And sometimes, if it's too superficial, because the skin is so thin here, it can almost give off a bluish hue. And so, this area can be a little bit tricky. And you definitely want to see an experienced injector if you're having this area done. I also find sometimes people think they need filler under their eyes, but really what they need is to reduce the puffiness or the bags under the eye. And the best way to do that is actually with a lower blepharoplasty or surgery where you can remove that fat rather than trying to add more bulk to that area, which sometimes makes it look worse. That's another thing about fillers. Back when they first came out, everyone was treating these areas called the nasolabial folds, which are those lines from your nose to the corner of your mouth. And over time, I've really actually steered away from injecting those areas because I find it can just add more bulk to the area. And as we age, our lower face gets heavier. And really, the last thing we want is more fullness in our jowls or our lower face. So I find that treating more on the angles of the jaw, what we call the mandible, treating the chin or the pre-jowl sulcus can be really helpful, again, in harmonizing and facial balancing. So I do still love HA fillers. I think they definitely have a place. It just needs to be done appropriately and with the right volume. I don't really think of HA fillers as being preventative with aging. However, I do think they help disguise some of the signs of aging, which can be the flattening of the cheeks, the jowling that can happen, and the bone resorption, but they don't really prevent aging. They're not particularly stimulating your own collagen like the biostimulants or like a laser procedure could do. One of the reasons I do love HA filler so much is that you can dissolve it. And I have been able to dissolve filler placed by someone else in the lips that was done totally incorrectly. Sometimes under the eyes with time, there can be some swelling that occurs here and some migration. And so it's nice to know that a little bit of hyaluronidase, which is this enzyme that can break down the hyaluronic acid filler, can be injected into the areas to dissolve it if you feel like you got a little overfilled or maybe you had more filler in your cheeks than you wanted and now you want to dissolve some of it. So I think it's great to have that option, that tool in our toolbox that if you do feel like you have been overfilled, maybe your lips have been overfilled, you can actually dissolve it safely. So that's one of the things I do love about HA filler. And I would just say if you're listening and thinking about getting it done, but nervous, just know that that is an option. If you don't like it, if you feel like it's too much, it can always be dissolved. The other great thing about hyaluronidase is that rarely, but it does happen, filler can be placed into arteries and cause skin death or necrosis. This commonly happens around the nose, in between the eyes, sometimes in the temple. And so that's why filler, it may seem like such a simple thing, especially because just about anyone is providing it in their office now or at the hair salon. I mean, it's really widely available. I joke soon it's going to be available at the drugstore. But filler does have complications, and it's important to know. So I would say the first is bruising. I don't really see that as a complication. That's just the nature of sticking a needle in the skin. You can get bruising, and some areas bruise more than others. So give yourself at least a week before a big event. I also think it takes a week for the filler to kind of settle down, smooth out, and any swelling to resolve. So yes, when you inject the filler, you do see immediate results, but I do think it takes about a week for things to look supernatural and very beautiful. So give it about a week of downtime. So like I mentioned earlier, one of the complications we see with filler is when it's actually placed into a little arterial or artery, and that can block off the blood supply and cause skin necrosis or death. This is why you should see someone who is skilled at injecting and knows how to manage complications. They know what to do if this happens. This is just something that can occur because we cannot see all those little blood vessels under the skin. But an experienced injector like a dermatologist or plastic surgeon knows where the high risk areas are and tries to avoid them or use things like cannulas to help lower the risk. One of the most feared complications is blindness, and this has occurred. It doesn't happen as often in the US because of the areas where it's being injected, but when filler is in an artery around the eye, it actually can travel retrograde or backwards and block off the blood supply to the eye, which is the ophthalmic artery. This is a really, really feared complication for obvious reasons, but it has happened. So again, treat filler like what it really is, a medical procedure that should be done by trained medical professionals. So, how do you know how to choose the right injector? Well, I would look for someone who has a lot of experience and skill, is medically trained. Of course, I'm biased to people in the core four aesthetic fields like dermatologists and plastic surgeons. I would treat this like the medical procedure that it is. Make sure you're in a clinic where they know how to handle the complications of vascular compromise. They have the right tools and equipment to address that if it were to happen. I'd also make sure that the aesthetic look of the injector and the people in the office match your aesthetic look. If you want very large lips and a very filled, borderline overdone look, you would be very disappointed coming to see me. So you want to make sure that the aesthetic look of the person giving your injections, as well as the people in their office, match what you're going for, because chances are that is the look that they like, that's what they know, and that you will get something fairly similar if you go see them. And when you are looking for an injector, do not price shop, do not shop around. I really recommend seeing one person who can treat the overall face, who is looking at you globally for your aesthetic look, not just focusing on your under eyes or focusing on your lips, but is looking at you as a whole, especially for that facial balancing. You may want really big lips and they may look beautiful on your friend, but based on your facial proportions, it may not be the best look. So you want to see someone who is focused on proportions and balancing and who's not afraid to say no to you if something isn't going to look right. Those are the people you really want to be trusting for your injections. I just want to reassure you, if you are thinking about hyaluronic acid filler or your dermatologist or someone recommends it to you, don't get scared. Don't go running away in fear, because when it's done well, it should be subtle. It should give a sophisticated and undetectable look. People should just think you look great. They shouldn't think, oh, she had filler, she had lip filler, she had chin filler, right? It should just look appropriate and balanced for your facial features and anatomy. I always tell my patients we can always add more. So I tend to take a more conservative approach because I can always add more filler if you want. Also, if it's overdone, you can dissolve it, which is another great option. If you want to hear my full episode with Dr. Westbay, you can check it out here, and I will see you next week.